when the bacteria is in the blood, the bacteria can go to other sites. For example, to the liver, or to the spleen, or to the kidney, or to the prostate in men. Okay? And in these sites of the body, Burkholderia pseudomallei may form abscesses. Okay? But this is less common than pneumonia. And remember, I told you that sometimes the bacteria may become latent. Sometimes, not always. Latency means that Burkholderia pseudomallei becomes inactive, like sleeping. However, this bacteria in a latent state can wake up and become active again and cause pneumonia again or abscesses again. Latency sometimes is for several weeks and sometimes is for several years, as I will tell you later. This is the most common. The most common is bacteria with pneumonia. This is the most common outcome, okay? This is not so common. Okay, so this is what happens after inoculation. However, Burkholderia pseudomallei may be also acquired through inhalation by the respiratory route. And this is also an important mechanism of transmission, mostly during the rainy season. Okay? Possibly inoculation is more common, but inhalation is also common. What happens after inhalation? What happens? Most of the times, nothing. Most of the times, patients remain asymptomatic. However, in some patients, after inhalation, in some patients, they may suffer pneumonia. Burkholderia pseudomallei may be also acquired by the oral route, by ingestion, but this is not common. This is very rare. What happens after that? These patients may suffer gastrointestinal ulcers, but this is not common. Okay? And after that, bacteremia. This is not common. The most common mechanisms of transmission are inoculation through the skin and inhalation. Ingestion is also possible, but this is not common. So look, this is a very simple picture about the pathogenesis of melioidosis, but very, very simple, because this is much more complicated. You will study this when you study infectious diseases. Okay. So we are here. Remember, most infections are asymptomatic. Most people remain asymptomatic. In people with symptomatic disease, the most common outcome is pneumonia. Latency, as I told you, so when this bacteria becomes inactive, like sleeping, this latency may last several months or sometimes several years, as I will tell you. This is a patient with a skin ulcer by Burkholderia pseudomallei, and this is the same. These infections are not very severe. Pneumonia is much more severe. This is a gram staining of Burkholderia pseudomallei. The appearance is like a safety pin. Look here, this one. Safety pin means the center is clear and the poles are darker. Remember that Yersinia pestis is very similar. The appearance is also like a safety pin. But this is not very important for you. This is how Burkholderia pseudomallei grows. This is blood agar, and this is the appearance of the colony. The treatment of melioidosis is very difficult because Burkholderia pseudomallei is very resistant. Patients with melioidosis should be always treated with antimicrobials. We are not going to ask you the treatment because you will learn the treatment when you study internal medicine or infectious diseases. just to tell you that the treatment is very difficult, and we have to combine many antimicrobials together to heal the patients for several months. The treatment is difficult. If you are interested, I show you here the treatment, but we are not going to ask you the treatment. And this is very curious. This is very curious because in some textbooks, Burkholderia pseudomallei is called the Vietnamese time bomb. This is very curious. And why this name? You know that there was a terrible war in Vietnam 50 years ago against the French, first to fight for independence, and later against the US 40 years ago. During this terrible war, soldiers from France and from the US, they were infected by Burkholderia pseudomallei, and they suffered a very mild disease, and maybe many of them were asymptomatic. When the war was finished, and they came back to their countries, after several years, these soldiers suffered melioidosis. After several years. And what happened here? This was the problem of latency. The bacteria was latent, inactive, like sleeping in their bodies, but the bacteria became latent later, after several years. That is the reason why some people call this bacteria the Vietnamese time bomb. It's very curious, because of the latency. And to finish the class, just to say very few words about Burkholderia cepacia, this is the other one. This is the other Burkholderia. And this one is not important here. This one is very important in my country, but not here. This is the reason why we don't say many things. So, Burkholderia cepacia.